Now let's get into our next discussion. The federal government says 813 people have now died from the cerebrospinal meningitis outbreak in the country.
Health Minister Professor Isaac Adewale confirmed this while addressing State House correspondents after the Federal Executive Council meeting in Abuja.
Meningitis is easily treatable once diagnosed. So we are going to improve on case finding, improve on treatment, so that we can really be on top of the situation. As of now, we are noticing the decline. This is week 16. This is also expected because we are moving away from the active season. So we are quite confident that in the next couple of weeks, everything will be over. The Minister of State for Health, we received about 500,000 doses initially. These 500,000 doses were moved to Zamfara. On Sunday morning, we received 150,000 doses of the 823,000. The remaining...
All right, the Minister of Health, they're giving backgrounds as to how much or how many vaccines they have gotten and where they were deployed to. But whether that is adequate or whether that is enough is something else. We have joining us now a medical doctor, Tui Mebawandu. Good morning.
Morning,
it's good to have you join us right now.
Good morning.
Yeah, thank you.
First of all, make us understand, when they say these vaccines for meningitis are not available, we got 102,000 doses, we got 2,000 doses, and where are they coming from? Where are they getting them from right now?
It's a sad story because let's look at it. Let's look at the vaccine gap. In Nigeria, for instance, if you are to immunize all the people, the people at risk against meningitis, we need about 21 million doses of vaccine. Huge one, 21 million doses of vaccine. Now, the vaccine, you have to source for money for the vaccines from WHO, you have to source from Bill and Melinda Gates Foundation, you have to source from Global Alliance for Vaccine Initiative. Then you source the money, you take the money to India to get the vaccine manufactured and then ship to Nigeria. That's the pattern.
It's a long process.
That's the pattern. And then now, the technology of vaccine production is not cheap. It's not cheap. Unfortunately, what we've done is that we've neglected a lot of our institutions, research institutions that are supposed to produce vaccines for us, like the one in Yaba and the one in Jos. That's supposed to be on the top of it and then produce vaccines for us. So now we have to rely on money from donors, and we have to rely on production from Asia to get vaccines to us. So 500,000 initial one, then the promise of 800,000 from Europe is actually a huge gap. If you add those two things together, just about 1.3 million doses. And now we're thinking of as much as 21 million doses of vaccine.
Let's try and take some of these issues one after the other. That of funding first. We've known that since last year that some of these donors said they were going to cut back on what they give African countries for vaccines. Gavi, for instance, made that clear, and some other development partners made that clear. Was that not enough warning for any serious country to be prepared that, okay, this money may not come in as they used to come in before? And that was last year. Between last year and now, why is there no adequate preparation in terms of funding, even from our own part?
Not just about the position of the donors, even the fact that we know we are in the meningitic belt. We know for sure that at certain part of the year, we're likely to have an outbreak of meningitis.
Yes.
Okay? That has been going on for 100 years, close to 100 years. Okay, we know all these things. Now, we saw the way the politics of Europe and this called developed country, it's been playing out in the recent past.
Yes.
We've seen them getting closer, closing their borders, reducing their interference in a lot of places.
Yes.
We saw how Donald Trump won. We saw the Brexit. We saw what was going on in France and everywhere. And then we cannot be sufficiently alerted enough to know that we need to actually look inward and be able to develop our institutions and then find a way to fund our own health system in a sustainable manner.
Yes.
Again, let's look at it. We look at our health budget. What are we doing? We've been moving forward. Initially, as at 2014, we were doing 5% of our GDP. Now we've gone down. We're doing like 3–4% of our GDP. And then even for vaccine alone, the health budget for this year cannot cover vaccine alone. There's a huge gap of close to $1 billion in that vaccination. So now the question is that, how do you now deal with these things? How do you now address this challenge? Now, we've not been able to prioritize health Because you want to change health, you need money, you need money, you need money. And then the point is this, are we now going to look at different way, unique way of really funding our health system if we want to get the result we so desire? Okay, now, are we pushing adequately for prevention that should actually be cheap and, you know, be effective at the local level where information is not getting to the people? Now, I am thinking that beyond a model for like creating institutions to look for funding, if it's possible to also look at how to establish a specialized financial institution to address our health challenges, not just in terms of vaccines, but also in terms of drug production, in terms of infrastructure, in terms of mobilizing human resources. You look at Nigeria, a country of close to 200 million. How many doctors are in the register? Less than 100,000. You know, a lot. Even the register has not even been cleaned for more than 40 years because a lot of them are dead. A lot of them have moved on to another thing. The register has not been cleaned. The only way you clean register is to look at people that return to do renewal of their registration. How are you going to manage?
We probably just have a false figure right now as we speak. The number of doctors we have in Nigeria.
That's doctors, the laboratory technicians and worse. And you are talking about epidemics that require specialized people to look at how to do surveillance, how to, you know, catch those things before they come, how to actually even do adequate diagnosis. And then we're looking at nobody, actually nobody. We're looking at the training for science. Our children are not doing science. You cannot be someone that is doing geography or whatever and put him to go and study medicine. They're not doing science. And then these are the big issues we're facing as a country, and a lot of us are folding our arms. It's easy for us to say, okay, I'm rich, I can then run to other countries to get health system. But what happens to the people that are voting for you, that cannot afford that, the local rural people that are just constrained and, you know, locked in these challenges of, you know, having access to good health system. Yeah. Why would we also be able to produce vaccine?
I've asked this question before. Some of the states you have this outbreak, they were among those who had it before, and they know that this is a recurring decimal within their belt, especially some states in the north. But there is a lot of attention, or there's a lot of eyes on the federal government. What are they doing and all of that, which is not bad anyway. But if we have to talk about the states that are closer or closest to the people one way or the other, what should states do in this regard?
A lot.
State governments.
The first thing the state should do is actually, you know, have what I'll call a profiling of the occurrence of diseases in their place. Now, in Nigeria, in the last 1 year now, we've seen a situation whereby we've seen epidemics coming up, whether polio, Lassa fever, now meningitis. The state should focus on preventive messages. Now, the state should be able to really, you know, categorize their local government, and even state and local government. Now, let's even not leave it for state alone. State and local, you'll be able to look at the local government and say that, listen, what are you doing? It's very cheap to discuss prevention. The primary health care is cheap. That's adaptable to our situation.
Let me just ask you, I just add that to that question. You're talking about prevention. What is the disease control, the Center for Disease Control doing really in terms of epidemics like this?
No, I'm sure you go around Nigeria. What they're supposed to do is actually to do prevention, to do surveillance, okay? And then to ensure that, you know, they nip the epidemics in the bud and then ensure that vaccines are deployed. The National Center for Disease Control and National Agency for Primary Healthcare Development, you know, should be able to work in tandem and help the state to really overcome. So
would you say they were alive to their responsibility in this case? Would you say the center was alive to its responsibility?
Well, they will claim they're doing what they're doing, but you know, the evidence of what you are doing is in the result. Okay, we've seen around the first of last month, we saw about 300 cases. In 2 weeks, it doubled. Now we're approaching 1,000 deaths. So again, that's in epidemics, we appreciate the fact that you may not have that sudden decline. You know, it goes up and then plateau before it starts coming down. But the question is this: after this, what are they going to do? What is the message the states are passing down each household about preventive care? You understand? How are we avoiding overcrowding? How are we disposing nasal secretions and coughs? You know, how is the government responsive? How, you know, even when they get to the hospital, what do they say? Because these are some of the things that discourage them from going to the hospital. They get to the hospital. You look, like I was talking about the doctors now. You get to a place like Zamfara State. You have, on government record, they have about 1,300 health workers, including doctors and everybody. Out of those numbers, 85% of them are fake. So we have about 200 health workers dealing with 4 million population. So again, you can see the challenge. So what we need to do is to mobilize at the level of prevention to the grassroots. We need to involve the traditional rulers. We need to involve the religious leader. We need to be able to craft our own internal NGOs that can go right there and ensure that, you know, common preventive method. Now, again, the other area the government needs to work on at the state level, if you are budgeting, you budget in such a way that you can provide housing, decent housing for people to prevent overcrowding. Now, when the dusty period is coming, that when this meningitis used to, you know, spike, you provide simple face masks for people to cover their nose. We saw in China when the bird flu was going on, they had to use face masks, and then, you know, these kind of simple things. You utilize spaces to educate people.
All right, we are wrapping up now, but you know what, according to the figure you gave earlier, the vaccine we've had so far is about 1.3 million. We have a population of about 180, talking about adequate coverage of vaccine.
Let's even say, if you look at those students, people that are at risk, maybe you are talking about about 70 million people. So now, for each of the vaccine, the cost is about $50. That is after, you know. So where are you going to get $50 multiplied by 21 million?
That's a lot.
You know, it's a lot of money in terms of, even if you look at the challenges we're facing health-wise now. So for us, you know, we need to be able to craft a local solution. And these things are not, honestly, they're not too difficult. We know that next year...
We have surmounted this before.
Yeah,
so it shouldn't
next
be
year,
too much of a big deal.
we're going to see another epidemic coming up, okay?
All right,
so,
Dr. Tui Mebaondu, thank you very much for coming on the program now.
My pleasure.
Thank you very much.
you.
Right. Let's go on a break, and then we'll come back to do more. But don't forget, top of the hour will be time for us to go for the news update again.